Good morning, everyone, and welcome to today's school health update for February 2nd, 2023. Thank you for your patience as I got the recording started and listed a couple of folks as our key presenters for today. We have quite a bit to go through, so we're going to go ahead and jump in. As usual, if you have any questions as we're presenting, feel free to use the chat function, and we will do our best to answer those questions. All right, so for today's agenda, we're going to go through some brief announcements. We'll go through our regular epidemiological data revolving around COVID-19, in addition to that, flu and RSV. We will talk about our school staff support working group, as well as the survey that they're looking to complete for supporting school staff, and hoping to have that done by February 28th. More info will be on slide 6 for that. And then we'll have our new feature, a Q&A with an Ask an Epidemiologist. All right, so some brief announcements as usual. If you are interested in accessing or having a supply of Narcan or naloxone available in your schools, you can certainly reach out to schoolsupport@pima.gov. We also offer at Pima County Health Department presentations about fentanyl for staff, youth, and families. There are also COVID test kits available for pickup at our warehouse. Just a reminder that, a key reminder that many of these are expiring in February 2023. This may also include the supply that you already have at your school, so just be checking those expiration dates. If you have any questions about that, again, feel free to email the schoolsupport@pima.gov email and we can provide guidance. And then there's also a link to request them there. I will send out this presentation at the end, so all active links in this presentation will be usable and accessible to you. And finally, if you're looking to schedule an on-site COVID-19 vaccination at your school site for staff and students for this spring, please do contact the Pima County Health Department's Vaccine Equity Program to organize a COVID-19 vaccine clinic. And you can do so by emailing vaccineequityscheduling@pima.gov. Pima County Health Department is also partnering with several organizations in the community to provide behavioral health support. And this includes emotional wellness presentations for staff and students. Presentations can be modified to meet the needs of the school. Typically, these presentations are 1 hour in length. Those topics include practicing mindfulness, managing stress, trauma-informed care, PACS tools, and Text Talk Act. As we move further and further into the digital age, we've included a QR code here. And if you're unfamiliar with how QR codes work, if you have a smartphone and open up your camera, and hover over that QR code, a link should appear for you to click on, and then you can fill out that presentation request form online, and there are descriptions about each of these presentations, which ones are for staff and which ones are for students, and we invite you to explore that to see if any of these options would be useful for you, your colleagues, or your student community. For this slide, I'm going to invite one of our guest speakers, Julio. Julio, are you on the call? I believe you are.
Yes, Michael. Should I go ahead?
Julio, you might be muted if not.
Can you hear me? Let's see.
Julio, I can hear you, Julio.
Technical difficulties. Sorry, everyone.
Is it just Michael who can't hear me?
Can everyone else hear him?
Let's see. Okay, for some reason I cannot. There we go. I got you. Sorry, Julio.
Okay.
All right, go ahead and proceed.
Okay.
It was on my end. Sorry about that.
Okay.
Let me get you back to the presentation.
Perfect.
All right, Julio, if you want to take it away on this slide.
Okay. Do you have the slide up?
Yeah, can you not see it?
No, I can't see it.
Oh my goodness. Let me share my screen again. Sorry.
It's okay.
This is the story of a millennial starting to struggle with technology, everyone. It happens to everyone, I think.
Yeah.
All right. Can you see that?
All right, there you go. Perfect. All right,
There.
everybody. So as you might know, February is National Children's Dental Health Month. Our oral health program here with the Pima County Health Department consists of two grant-funded programs. We have First Smiles Matter, and then we have the Cavity-Free AZ. So our First Smiles Matter program is busy going out to Head Starts, elementary schools, screening children in preschools, elementary schools, and some of these numerous Head Starts located throughout Pima County. This month we are handing out a lot of information from the ADA, a lot of coloring sheets, crossword puzzles, a lot of fun stuff. We're going to be dropping off some really nice tooth fairy books that we have from our warehouse. And then of course we have the Cavity Free AZ program that's going out to middle schools, providing sealants for kids and elementary schools also. So we're definitely busy out there handing out a lot of information, a lot of resources in the community, and we're partnering with the Pima County Libraries this month also, visiting sites, and then we are doing some of the resource centers as well. So keep an eye out for our program, any applications, any consent forms that might come your way. Thank you, Michael.
Thank you, Julio. And if anyone is interested in contacting you for more information, what would be the best way to reach you or the program?
520-724-7902. I'll go ahead and put that in the chat.
Perfect. Thank you so much, Julio. And
Thank you.
I hope February is awesome. Happy National Children's Dental Health Month. All right. And so now I'm going to invite our next guest speaker, Raquel Goodrich. Raquel, are you on the call?
Yes, I am. Can you hear me okay?
I certainly can. You know, I didn't have my volume up before, so now I got it all figured out.
Awesome.
All right, take it away.
All right, good morning, everyone. I'm Raquel Goodrich with an organization called Text Talk Act, and I'm also the chair of our school staff support group. So I wanted to give you a little bit of a background about who we are and what we do, and then I have an ask for all of you. So we are part of the Pima County Behavioral Health Coalition, and our staff support work group started around April of 2022 last year. And we were tasked with helping educational and school staff to better support their mental health. So when we first met, we said, what does that look like? How do we best help? And decided that we really needed to host some listening sessions to better understand what the needs are of our educational staff. So we conducted a series of listening sessions and then analyzed all the data. We've put together a work plan. And one of the priority areas that we have created or seen, or identified rather, is the need for increased and better coordinated mental health services. And we heard from staff that they need it for themselves. They also need it for students and for families within the educational system. So we are now working to create a mental health wellness directory for schools here in Pima County. And the idea is that it will be a one-stop shop where you can go to basically order services for your school. And so these could be mental health educational services, they could be direct services. It will really be kind of a range of activities that are available for your school. Next slide, please, Michael. And so with that, in starting to create this, we want to better understand what existing services and activities your school is utilizing now. And this information is going to go directly into our online database. And so it will give us kind of a good sense of what's available. And we also want to learn what you would like to have that's not available. So we have a very simple Google survey. And as Michael said, you know, we're trying to use these fancy QR codes here. So you can either scan that QR code or you can click on the survey link, and I'll put it in the chat as well. And I think, you know, for all of you, you're the right audience in terms of who should be answering the questions about what your school does. If you feel like there's somebody else at your school that should either also answer the survey or that would be better suited, we ask that you would just forward it to them. And so the survey takes about 5 minutes. It's nothing too long, but it's going to give us a lot of information that we'll then be able to use for our online database. So please, when you get a moment, you can even open it now just so it's in your browser for later. Please do consider filling out the survey, and it will close on February 28th. So we're giving everybody about a month to do it. Thank you so much.
Thank you, Raquel, and thank you for helping organize this. I know you've been the leading driver on trying to get this information collected so that we can best serve our schools, but especially our school staff. Do you have any goals in terms of the sample size? What's our goal sample size for this so that our folks on the call know kind of how many folks we're aiming to reach?
We would love to hear from as many schools as possible. And so one of the questions in there is going to be your school and your school district. Really, we want to make sure that we get input from all of the school districts for sure. And then as many schools within those districts as we can so that we can get a really comprehensive look. So yes, at every school, we'd love to have this survey filled out, which I know is very ambitious, but that's what we do, right?
It certainly is. Hey, thank you so much, Raquel. For anyone who wants to scan the QR code, I'll give you another 5 seconds here to open up that camera app on your phones, scan that, and then Raquel is also going to throw that Google form link into the chat. All right. Thanks, Raquel. And now I'm going to invite Matt Christenberry from our epidemiology team here at Pima County Health Department. Matt, are you on the call?
Hey, good morning, Michael. Good morning, everybody. So thanks for having me on and to provide an update on some respiratory diseases that we're continuing to see circulate. We'll continue providing these updates for now as RSV and flu season continue to trickle downwards. We will alter kind of our updates on that, but first, we just wanted to start off by providing a quick snapshot of our COVID-19. So looking back at January 26th, the Pima County community level is still in the low level, as you see on the left there. We did go up about 13% compared to the previous week, but we are still low, so that's good news. In addition, when we look at the rate of transmission, we are at substantial, and we've been at that high level for quite a long time. So that's also continuing to go downward, so that's good news. So if we look at our case rate, we are about 64 cases per 100,000 population. And again, that's about a 13% increase. Our testing positivity actually is about the same. It went up almost 1%. So we're at almost 8% right now of those that are testing positive. In addition, if we look at those 5 and older, about 22% have received the updated bivalent booster. We continue to push messaging on that. As we know, the bivalent booster, there's still a lot of people that need to get that update. It does show to be very effective against currently circulating variants of COVID-19. So that's good news on that front. And again, these are updated every Thursday, so we'll get an update this afternoon for this week. But that's where we are with COVID right now. Next slide, please. And again, just the view of the U.S., as you can see, we're seeing a lot of green, so that's good news. We are still seeing some yellow and some orange/red over in the southeast part of the U.S. So we'll continue to monitor each trend as we go forward. Next slide, please. And again, this is just kind of highlighting how to calculate the community level and where we are with our community level. And as a reminder, we're about 64 cases per 100,000, and we're still having about 5 new COVID admissions per 100,000 population. Next slide, please. And then looking at the community transmission level, and as you can see there, Pima County is in that lighter color, the orange there. And we still have quite a few counties in Arizona that are in red, and we actually have one that's in moderate level. So we are still sitting at substantial, and as we all know, the difference here, we have 4 categories of the community transmission versus the 3 categories of the community levels. Next slide, please. All right, so an update for flu. As you can see here, especially on that graph on the right, again, those blue lines are what we're seeing for the current year. And again, for flu season, it goes by the flu season, which starts in October. It doesn't go by the physical year or calendar year. But as you can see there, the blue line for 115.23 is quite a bit lower than what we see in that gray bar, which is the 5-year average. So we'd like to look at the last 5 years to better understand what's a typical season. If we do year to date, though, we are still about 2.6 times higher than the last 5 years. And again, we're still seeing 28% of cases are those 5 to 18 years of age. If we can focus in on MMWR week 3, we have 53 cases, which is 0.3 times lower compared to the last 5 years, as we're typically winding down in our flu season, but we still usually have a lot more cases. And we actually had about a 62% decrease from MMWR weeks 2 to 3, and 92% were type A. Next slide, please. And then RSV. And just as a note to the state, this is where the data comes from, the state health department. They update their data on Thursday mornings. So like right as this call comes online, there'll be new updated data. I've checked it out and it's very similar to this, but with RSV, we're still 5 times higher than we were for the last 5 years for our RSV season. 33% of those cases are among those 1 to 4 years of age, which again is typically our second most age group that's infected with RSV. Typically, those under 1 are the highest age group that has the most cases. But again, if we look at our trends for the most recent week, we're very typical for what we normally see. We normally have about 28 cases, and we've reported 29 cases. We had a 46% decrease from MMWR weeks 2 to 3. Next slide, please. And again, we just wanted to leave the disease reporting slides up about how to report, who needs to report, and when you need to report, and the different methods that you can do to report. So again, if you ever have any questions on this, please don't hesitate to reach out to the EPI team, and you can go to the next slide for that. Or 2 slides from now. But yeah, this one again, just a reminder, I really encourage anybody on this call, if you have not downloaded this app or if you have staff that want to download it, please share this information with them about the Healthy Kids AZ mobile app. It's a really great way to be informed and just have a quick tool available on your phone, so you can get some good information on things related to diseases or vaccine information. Next slide, please. And again, just highlighting how you can contact our team. If you prefer to send us an email, you can send us an email to epi@pima.gov. In addition, you can always email our schools team, and they are very good about coordinating with us on notifications that come through. And then, as I've seen, we continue to get calls from our schools directly. We have somebody answering that phone. If you do get a voicemail, it just means that the line is probably occupied, and usually we'll get back to you pretty quickly. And again, if you want to fax us, you can fax us at that number there. And I just wanted to bring up, it's not on the slides, but some of you probably have seen this week that there was an announcement from the White House about the end of the public health emergency. So there's still some talks on what that's going to look like for COVID-19. And the WHO, which is the World Health Organization, they actually reinstated their public health emergency of international concern. So as we get more information at the local level on what this means, we'll be sure to update our partners. We don't know what kind of implications they'll have to things like reporting, and I know that's a big thing for a lot of our schools when they reporting requirements for testing and things like that. So as we get more information, we'll be happy to share that and how that can impact any things that our schools are doing. And that's all I got. So thanks.
Hey, thank you so much, Matt. And again, if anyone wants to reach out to our EPI team, again, this information on this slide is exactly how to do that. They do get back very quickly. Of course, if you have EPI questions and you want to reach out through the school support email, you can do so too. And we'll make sure you get linked accordingly. Thanks so much, Matt. All right, just a reminder for folks. So the next schools call will occur on Thursday, February 16th at 9 a.m. We are on a bi-weekly schedule now, meeting on the first and third Thursdays each month. Of course, we are accessible beyond the first and third Thursdays, so please do contact us either at any of those, the EPI team information, or again at the school support email, so schoolsupport@pima.gov, or through the school support phone line at 520-724-7018. Just a reminder here, so a number of resources that we've talked about in this call are collated here. We do have some information lingering from monkeypox as well, if you're interested in that, although that is not as much of a concern as it was several months ago. But I do also want to highlight here, if you remember from the slide, for folks ages 5 and up, we are seeing somewhere in the 20% folks who have gotten the bivalent booster shot. So you as school champions, folks who are interested in the health and wellness of your school communities for staff and students, you can certainly help Pima County Health Department help you by reaching out to the vaccine equity team, so vaccine equity scheduling at pima.gov, and they would love to set up a vaccine clinic at your school site. So if you are someone who is willing to help us get parental consent forms, we can do those during the school day and try to make that as easy on parents and the staff as possible. That is all that I have today. So let's move into, if you have any questions for our EPI team or anyone else who was on this call, feel free to put them in the chat at this time, and we will start answering those. And just a reminder that Google form for the school support survey is in the chat. If you have 5 or 10 minutes to go ahead and complete that, we would surely appreciate that. Our goal is to reach every school, and we want representation from every school district as well as our charters. And if you know anyone who would be well suited to take that survey, please do copy that link and forward that. If there are no questions, not seeing any in the chat, then what I will do to encourage you to take that survey is I will turn over the remaining 7 minutes of this meeting for you to go ahead and complete that survey, please. I want to thank our guest speakers today, Raquel, Julio, and Matt. Thank you so much for making this call what it is. And thank you to our wonderful school partners for continuing to work with Pima County Health Department to ensure our communities are healthy and safe. Thank you so much and have a great rest of your Thursday.